for their children are concerned. We have put administrative flexibility in place to make it easier for parents to apply for and continue receiving a child care subsidy. And for child care providers that accept subsidy payments, we are increasing the total number of absence days for which they can be reimbursed to account for increased absences by children in their centers. We're also adding flexibility around tracking attendance and getting paid. Our Medicaid program is announcing additional strategies to ensure access to health care, including eliminating co-pays for services, extending prescription refills to 90 days, and enhancing telehealth options. Our Medicaid Director, Karen Kempsey, will tell you more. Director Kempsey, thank you.
Good afternoon. Our team at the Virginia Medicaid Agency has been working at an intense pace to implement these policies as quickly as possible. And we're not done. The policies the Governor announced today are the first phase in our response to COVID-19. Federal officials are continuing to provide us with additional flexibilities for our Medicaid rules, and our staff are following these actions very closely so we can best determine how to use these flexibilities to support our members and our providers. The policies Governor is announcing also addressed urgent priorities needed to ensure access to care to our members. We want to make sure that any Medicaid member who is sick can seek medical attention without worrying about how they're going to pay for it. We also want to reiterate that Medicaid coverage also covers testing and treatment for COVID-19. We're committed to doing everything that we can to make sure that our members also retain their coverage during this very critical time. We're very focused as well on the specific needs of our vulnerable, high-risk populations to ensure that these individuals have the support that they need to stay safe and well. We will have more information on how we are assisting these individuals in the forthcoming days. We're also working closely with our providers, including the hospitals, the nursing centers, and our managed care health plans on the best ways that we can help them to support our members. We have more information about Medicaid's response to COVID-19 on our website, coverva.org. Virginians who need health coverage can also visit coverva.org to find out if they're eligible for Medicaid. They can also apply for health coverage at any time by going online to commonhelp.virginia.gov. And please, if you are uninsured or if you know somebody who is uninsured, please take the time today to apply for the health coverage. Thank you.
Thank you, Karen. We know that people in our correctional facilities, as well as their loved ones, are concerned about the potential spread of this virus in those confined populations. Our Department of Corrections has suspended in-person visitation at our state correctional facilities, as well as transfers to those facilities from our local and regional jails. Secretary of Public Safety Brian Moran is here with us today to talk more about guidance issued today to those local and regional jails. Secretary Moran, thank you.
Governor, thank you. Brian Moran, Secretary of Public Safety and Homeland Security, and as the Governor mentioned yesterday, we were able to report on the extraordinary efforts of our Department of Corrections to reduce the interaction by suspending visitation and suspending accepting of inmates from local jails. As I also mentioned, we are working and have been working for several days since the onset of this virus, working with our greater correctional system here in the Commonwealth, our entire criminal justice system, from prosecutors to sheriffs to law enforcement. And so today the Governor is issuing guidance to them. We want to reduce the interaction and particularly this vulnerable population that may exist in our jails. So one, we are encouraging the use of a summons. That means when the officer comes in contact with an individual, to use the summons as opposed to a custodial arrest, if public safety dictates, and we are encouraging that. Second, we would ask our magistrates and judges to consider alternatives to incarceration. Something in the parlance of an attorney, you use the personal recognizance bond. Allow people to remain out and not incarcerated. And third, we would ask our judges and prosecutors to consider modifying sentences for low-level offenders, to modify a sentence, alternatives to incarcerations. An example would be home electronic monitoring. So this is an encouragement. Obviously, public safety weighs on all of these decisions and the primary concern of the governor, but we really would like to emphasize and encourage our entire criminal justice system to take this virus very seriously, as all of us are doing, and protect those vulnerable populations, not only the inmates that are in our ward and custody, but the personnel, all of our correctional officers, all of our sheriffs, all of our law enforcement personnel. Their safety is our utmost concern as well. Thank you.
Thanks, Brian. Appreciate it. We also know that this situation has economic impacts, and we are preparing for those consequences to our workers and our employers. As of yesterday, we've received 10,000 unemployment claims from Virginians. We have taken steps to ensure that Virginians who have lost jobs due to COVID-19 can apply for unemployment without the usual 1-week waiting period. Yesterday, we told you we were submitting our application to the Small Business Administration to allow businesses to apply for loans. Just an hour ago, that application was approved. Also, Sadie Lane will give you an update on how we are working with retailers on that.
Well, thank you, Governor, and good afternoon. As the Governor mentioned, our primary focus obviously has been on the public health aspects of responding to the coronavirus, but we certainly do recognize this is going to have a financial impact both on our economy, our citizens, and certainly our state budget. And anyone that would tell you that they know exactly where this is going to end up is just not being credible, because it's a fluid situation. Things are changing rapidly. All we know is going to have a significant impact on all three. But I want to stand in front of you today and give you a couple things that we can do to help lessen the financial burden on some of our taxpayers. So I have two announcements today on behalf of the Governor to provide tax relief for Virginia individuals and businesses. First, as the Governor mentioned, we have tax sales returns that are due tomorrow. And there'll be a message coming out from the Commissioner of Tax later today that will consider requests for sales tax dealers for an extension of the due date for filing and payment of the February 2020 sales tax return that are due tomorrow until April 20th. Now, this will be a liberal granting of the request. The reason why you need to make the request is because our tax receipts for sales tax don't only affect the state budget, but also some of our localities and our regions. And therefore, we take seriously whenever we have to take monies from one part to pay for something else. The Governor mentioned that we do work closely with our federal partners, but unlike our federal partners, we must balance our budget and we can't print money. So we take seriously as we move forward, but we want to give taxpayers for sales tax the opportunity to take advantage of this relief. We think this will probably cost us somewhere around $145 million, of which about $30 million of that will be felt by the local communities that receive these taxes also. But we're trying to make sure that we balance all the various needs of our constituents. Now, we'll have to charge interest because we don't have, without General Assembly approval, the ability to abate interest. But we will work with our partners in the upcoming reconvene session to make sure that we can have that also alleviated. We're also announcing today an extension of the due dates for payment of Virginia individual and corporate income taxes. Filing deadlines for those that will remain the same. That is, on May the 1st, your tax returns are still due. But the date for payment will be extended until June 1st of 2020. We anticipate this will be about $100 million in moving from this fiscal year into the next fiscal year. And that's important because, as I mentioned, Virginia has to make sure we balance our budget in each particular fiscal year. And as you know, we're in the middle of a budget cycle. We do not have appropriation authority past June 30th of this year. Virginia will not charge a late payment penalty if payment is made by June the 1st. But please note again that interest will accrue, so taxpayers, we would encourage you to file by June 1st to avoid this, although we will work again with the General Assembly to be able to abate those interests also as we go forward. So as I mentioned before, additional guidance will be available today coming from the tax commissioner and be available on his website. And we will look as we go forward and this situation changes to offer other ways to help alleviate some of the economic impacts that this coronavirus is having on our citizens and our economy. Thank you.
Thanks, Secretary Lane. Appreciate it. And finally, we are directing the state police to suspend enforcement of motor vehicle inspections for the next 60 days. In closing, I want to reiterate the need for every single one of us to take social distancing measures to slow the spread of this virus. There is evidence of community transmission in the northern and central regions of the state and in the peninsula. Infectious diseases do not respect boundaries. All people within these areas should remain vigilant. We expect that community transmission will expand to other areas of the Commonwealth in time. That is why all Virginians need to practice individual prevention and control measures. Our health is in your hands. Know the signs and symptoms. If you're sick enough to seek testing, you're sick enough to stay home for any reason other than to get medical care. Remember that those with mild illness can transmit this disease, so if you're sick, please stay home. If your doctor or a public health worker has told you to stay home, please heed their advice. As we have said, these instructions especially apply to people with underlying illness or those over age 65. So stay home, do not have large gatherings, continue to take basic health precautions, especially washing your hands frequently. We continue to work closely with our hospitals and our healthcare providers to ensure they have what they need to take care of people. And as I said yesterday to our providers across the Commonwealth, I say thank you for your work. We all have a responsibility to one another. Every single one of us must take these actions to take care of one another. We'll be glad to answer your questions.
Are you considering taking any additional actions to address the coronavirus when the General Assembly is expected to reconvene in April? And is that still happening in April?
Yeah, there are several options, and as you know, they have disinfected the Pocahontas building since our legislators went home. They are due to come back to Richmond on April the 22nd. Depending on the status of COVID-19, we will look at options. We are working with our Attorney General as we speak, not only for the reconvene session, but to also address boards and commissions. I know that's been a question on a lot of folks' minds, and hopefully we'll have some guidance in the next 24 hours on that. But certainly we're looking at options for reconvene session.
Governor, can you tell us what you spoke about with Governor Hogan? And he has asked that you reconsider whether to close all restaurants. Did that come up, and are you reconsidering that decision?
Well, as you ask, or your question about our conversation with Governor Hogan, we have a great relationship. We're neighbors. We've worked on a lot of issues to include Metro, to include the Chesapeake Bay. And specifically today, Greg, we talked about what we can do on a state level to keep our citizens safe and to make sure that they're getting updated and accurate information. So we had a great conversation. We worked on a lot of issues in the past, and we'll continue to do that as we move forward.
And the restaurant issue, are you reconsidering whether to order closures there or not?
We're not making any changes in our policy.
Governor, there's a second case now in a long-term care facility
Yes.
Can you talk to us about those concerns and what you guys are doing to make sure you stay on top of that?
Yes. Dr. Peake, I may let you address that. Again, I've tried to, it's always tempting to, but I'm going to.
The question you asked was that there is another case in a long-term care facility, and what are we doing about that situation? So when we identify those cases, we send a team of epidemiologists in, also experts in infection control. And we're working very closely with those facilities to identify people who are exposed and to provide instructions for how to isolate, quarantine people, how to do cleaning, and just all the measures that need to be put into place. And the healthcare facilities that we're working with have been very responsive, and so we're working through these issues as they come up.
Yes, Kate. Yeah. Given the still limited amount of testing available in the state, I was wondering if there's an estimate on the number of undiagnosed cases that could be circulating, and if the state is doing anything to boost capacity of testing other than waiting on kits from the CDC.
It's actually kind of a twofold question, but I'm going to let Dr. Tony answer as far as our testing capabilities. Thank you.
Sure. So your question was what we are doing to try to boost the number of tests that we have available. And while we are continuing to rely heavily on the CDC qualified reagents, we also understand that those reagents are in limited supply, and we are in the process of bringing up our own laboratory us to independently, outside of being dependent on those CDC reagents, be able to stand up methodologies and a way to detect the virus independent of having to order the reagents and ancillary supplies that go into the CDC test.
And then in terms of the number of cases that
So the question is, do we know how many cases or estimate might be undiagnosed? We don't know that at this time. We're still learning about this situation. It's evolving. We are looking at experiences in other states and trying to look at modeling. So we hope to have more information moving forward. But we are seeing an increase in reports now, or labs being reported from outside private labs. So there does seem to be more capacity there, and we're happy to see that. So we would like to have more testing, and we continue to work with all of our partners to make some of these tough decisions so that we can make the tests that we have go as far as we can.
Yesterday the president said there would be a teleconference with all governors and FEMA. Did that happen? And so what came out of it?
Yes, I wasn't part of that today. I was actually in meetings and preparing for this conference, but I have been in Virginia with the president and his staff, so I'm not sure. I can't answer what was discussed in the meeting today.
I was going to say for the state epidemiologist, do we know what the capacity is of the private labs? We have 1,000 for the state lab, and what private labs have capacity for right now?
You're asking what is the lab capacity of private labs, and we don't have that information. There's no requirement for private labs to
The question, thank you, Henry. The question was a letter that I received from our lieutenant governor. And I would say that I've received letters, other types of correspondence, whether it be via email, by the phone, in person. A lot of individuals, as you might imagine, are offering their input. And I greatly appreciate their input, and I take it all into consideration. And then through discussion with our staff, I make decisions that are in the best interest of Virginia every day.
Hi, this question is also related to testing.
So you're asking why is there a discrepancy in numbers that you hear in reports from localities and the numbers of cases that we have on our website. So like other states, like the CDC, we use an electronic system to track cases. And we do have to have a cutoff for that system for when we can say this is the number of tests that we have at this point. We have to validate that information, and then we have to post it to the website. So the numbers are cut off at 5 p.m. the day prior to posting them, and we post them at noon. That being said, we're not trying to restrict that information. We're making sure that the local health departments and others are following up on any cases, and if they need to put out a press release to let people know, they will do that. So there will always be a lag, and as we continue to get more tests reported to us from private labs, that could also be a little bit of a delay. So that's just something we have to work through.
Also a question for the website. I saw earlier today you had the breakdown by area along with tracking whether or not the case was travel-related, linked to another case or undetermined, and that's been removed in the last hours. Can you speak to that?
Yes, we did. So as I said, we have an electronic system now, but there is a little bit of a lag between getting all of the information into that database, and the information wasn't correct, and so we took it down. And at this point, it's changing so rapidly that it's not. We don't want to put that up there because we don't want to put inappropriate information or incomplete information up there.
Yeah, it's a great question. The question is, would we be willing to extend the time frame of our closures across Virginia, specifically for schools or other things as well? And my answer would be that this is such a fluid situation, and we meet every day, hour by hour, and so if the need comes to make a change in how long we're predicting or anticipating, we will, but it'll be kind of on a day-to-day basis.
I have time for about one more. Yeah, Henry, and then Cam for the last one.
We're getting a lot of phone calls and our newsroom messages from people who are out-of-state employees who still have to go to work, or the average person who has to go to work, and they're worried about their employers not putting protective measures in place for them. What do we tell them at this point in time? Is business up? Can this still be open? What should we tell people?
Yeah, obviously, Henry, the question is what we tell people, employers, employees that feel that their health is at risk. And I would just say we are continuing to reach out and communicate with businesses, with employers, with employees. We obviously get a lot of the same calls, and we just encourage, again, basic health precautions. And I don't know if you'd like me to list those off again, but just, good sanitation. And obviously, Henry, there are some businesses that are literally essential out there that we must have. And so we need to do everything that we can to be vigilant and to your point, to protect everybody. I said we're only as healthy as the person that we're in contact with. So we'll continue to work with our employees, and again, make sure that they all feel that their needs are being cared for and that they're safe in Virginia. Thank you for the question.
And my question was pretty much the same thing, but so is there no outlet, nothing that they can do, calling the state, calling local health officials, saying that we're 15 deep, shoulder to shoulder, they just have to either work through it or quit at this point? They have no other option?
Maybe.
Well, I'll be glad to. The question was, what is the option when an individual worker or an individual or employer or coworker has a question about those safe practices? I think one of the great resources that we use every day is the recommendations that are in the Virginia Department of Health. Those reflect CDC guidelines and give good general advice about what social distancing means, and advice also for how to implement that. So I think, one, there's that standard. We would also ask that our employers, I think employers in Virginia, including the state as a major employer, cares deeply about our workers. And I think that we also need to, as we learn that if there are problems, we will develop solutions and better communication mechanisms. So.
Thank you all.
Just a final announcement. Again, thank you all for being here. We were scheduled today, as you know, to have our conference at 11. We postponed it until 3 because the president had a conference at 11 today, and we thought it important that Americans and Virginians hear his recommendations and guidance. But tomorrow, unless something changes, we'll be on schedule to be here at 11 o'clock. So thank you all for joining us.